Itching, discharge, discomfort. Do you think it's a vaginal yeast infection? Under the microscope, the truth is often very different. In this video, I'll show vaginal yeast under the microscope, and together we'll clarify what a vaginal yeast infection really is, why it occurs, most importantly, how to treat it correctly, and how to prevent it from coming back. Part 1. What is a vaginal yeast infection? Vaginal yeast infection is not rare at all. In fact, 3 out of 4 women will experience it at least once in their lifetime. Many people think vaginal yeast infection is a mild condition and that buying medication on their own will cure it. But in reality, many cases keep recurring despite treatment. Sometimes it is not actually a yeast infection, or the treatment is not appropriate. Vaginal yeast infection is usually caused by a type of fungus called Candida. This fungus already exists naturally in the vagina in small amounts. When the vaginal environment becomes imbalanced, the fungus overgrows and causes inflammation, itching, and discomfort. And these factors are why many women experience vaginal yeast infections over and over again. Part 2. Causes. There are many factors that increase the risk of vaginal yeast infection. The most common cause is antibiotic use. Antibiotics kill harmful bacteria, but at the same time also eliminate beneficial bacteria, creating conditions for yeast to grow. Hormonal changes are also an important factor, such as pregnancy, use of birth control pills, or hormone therapies. All of these factors share one common point. They disrupt the balance of the vaginal environment. Other factors include high blood sugar or diabetes, weakened immune system, wearing tight, non-breathable clothing, vaginal douching or using scented products. A vaginal yeast infection is not considered a sexually transmitted disease, but sexual intercourse can sometimes trigger the onset of symptoms. Part 3. Symptoms of vaginal yeast infection. The severity of symptoms can vary from person to person, but the most common symptom is vaginal itching. Other possible symptoms include white, thick discharge that looks like cottage cheese, redness and swelling of the vagina, a burning sensation, especially during urination or intercourse, pain or discomfort in the vaginal area. Important note: it is not always yeast just because there is itching. Bacterial vaginosis, or some sexually transmitted infections, can also have similar symptoms. Part 4. Diagnosis of vaginal yeast infection. Doctors do not rely on symptoms alone. They also perform a gynecological examination, order laboratory tests such as vaginal discharge examination, examine fresh vaginal discharge, and perform microscopic staining. The doctor will collect a sample from the cervix. This sample is stained using a gram stain kit, then observed under a microscope. Take a look here. The yeast appears oval or elliptical in shape, sometimes with budding yeast cells and long fungal filaments. These are called pseudohyphae. Therefore, microscopic examination of vaginal discharge is considered the gold standard for confirming whether a yeast infection is present. Part 5. Treatment of vaginal yeast infection. Many people think that once they have a vaginal yeast infection, they only need to buy medication and insert it, and that is enough. In reality, some mild cases of vaginal yeast infection can be treated with over-the-counter antifungal medications in the form of vaginal suppositories, topical creams, or oral medication. However, this is also the reason why many people experience recurrence. Repeated incorrect self-treatment not only makes the condition more persistent, but also makes future treatment more difficult. You should see a doctor immediately if symptoms are severe or long-lasting. The infection recurs many times. Medication has been used, but symptoms do not improve, or this is the first time you experience this condition. In these situations, a doctor will help identify the correct cause, choose the appropriate medication and the correct dosage. Avoid prolonged, incorrect medication use. Therefore, in addition to proper treatment, correct prevention of vaginal yeast infection is the key factor in determining whether the condition will recur. Part 6. Prevention and when to see a doctor. Preventing vaginal yeast infection is not about doing many complicated things, but about maintaining a balanced vaginal environment. Some things you should keep in mind. Do not overuse antibiotics. Wear breathable underwear made of cotton with good moisture absorption. Avoid scented or heavily foaming cleansing products, or those that are not suitable for vaginal pH. Do not perform deep vaginal douching. If you have diabetes, maintain good blood sugar control. After swimming or exercising, change out of wet clothes as soon as possible. You should have a routine gynecological checkup at least once a year, and see a doctor early if symptoms do not improve. Yeast infection recurs multiple times within a year. You are pregnant, or you are not sure which gynecological condition you may have. Conclusion: vaginal yeast infection is very common, but it should not be taken lightly. When you understand the true causes, receive proper treatment, and apply appropriate prevention, you can significantly reduce the risk of recurrence. If you are interested in health-related content, please follow the channel to watch more upcoming videos.